welcome guys, this is great. It's great because it's a course, but it's like so intimate, right? And so different because we're gonna be dealing like the whole weekend with live patients. Like the first rotation, which starts at 9, before the last two clinical intensives, we would do these on one another, right? But then I said, screw it, we'll just get real people and it'll just heighten the experience. So the whole weekend is gonna be about 67 patients coming through here. We also have kind of a thing where I ask them all to bring a canned good because there's a local food bank. 60 people bring a canned good, we get a nice little collection going. So that's a thing. So there's going to be rotations. It might even look maybe or feel a little bit overwhelming, but it's not. All right, and everything has a method to the madness. And yes, we're going to be doing a lot of work, but we're going to have more than enough time. Although part of this is time management, what the whole purpose of the clinical intensive is we want to take the visit and we want to break it down into the elements so that each one of these elements we do really, really well. So it's assessment, right? So mechanically speaking, EXSTORE, right? Because we know the approach if we're dealing with a chronic systemic problem. We don't do a lot of assessment. We don't do deep needling. We focus on perfusion, distal, auricular, distal points, stuff like that a lot of us do anyway. But it's assess, it's activate, using the pointer plus, getting comfortable with the pointer plus, getting really comfortable with motor points, getting really comfortable with all of the difficult points, serratus anterior, QL, all of the levator scapula, all of those ones. Then there's neuromodulate, it's EDO work. And then it's renovate, soft tissue work. So what's going to be a bit different about this too, I call it almost on-the-job training, so to speak. Like in traditional courses, they'll be like, okay, we're going to do 10 motor points, let me demonstrate them. And then everyone gathers around and we demonstrate it. Well, all right, let's go practice it. So here's a bit different where a lot of us know the motor points already. So rather than demonstrating, all of us will get, for example, this is 9 to 10, 15. You'll all have this sheet. And I'm going to explain the first 2 rotations, and then I'm not going to explain anything else until lunchtime. We're just going to break it down because there's a lot of time for that. So what we're doing is this. We said we're breaking everything down: assess, activate, neuromodulate, and renovate. So we're going to be doing all of this, but we're going to be learning this with the same time as how to manage time. So all of this, we still have to do it within time. So how are we going to do that? So that's how we're breaking everything down.